It is World Diabetes Day today, and it marks a crucial day in raising awareness about diabetes and promoting well-being for those living with this condition. The theme for World Diabetes Day 2024-26 is diabetes and well-being. This year's focus, it emphasizes the importance of addressing the physical as well as the mental health challenges faced by the people with diabetes. Now, according to the International Diabetes Federation, 77% of people living with diabetes have experienced anxiety, depression, or another mental health condition because of their diabetes. In fact, I'm currently joined by Dr. S.V. Madhu, former in charge Center for Diabetes Endocrinology and Metabolism, GTB Hospital, Delhi. She's also the president of the Endocrine Society of India and Research Society for the Study of Diabetes in India. Welcome to NDTV. My first question is obviously about the diabetes management. What are the most effective strategies for managing diabetes, and how can individuals with diabetes maintain a healthy work-life balance?
Can't hear.
All right, we'll try and connect that line with Mr. S.V. Madhu. It is, as I said, World's Diabetes Day. In fact, the ICMR MDR report has suggested a couple of food that affects, triggers in the diabetes epidemic in India. This includes red meat, French fries, fried items, bakery products, parathas, samosas, and sugary treats. In fact, multiple ways that one can prevent diabetes and keep it in check is by following a healthy eating plan, skipping fat diets and making healthier choices. More importantly, avoiding smoking, which contributes to insulin resistance. Meanwhile, being overweight or being obese, it contributes, or in fact, it basically contributes to the risk of type 2 diabetes. Some of the other factors that affect diabetes or put you at risk for type 2 diabetes are high blood pressure. There is also family history of diabetes. If you have a family history of diabetes, that can be one of the contributing factors. Low levels of good cholesterol in your body, that also is one of the contributing factors. High level of triglycerides, a history of diabetes in pregnancy, meanwhile history of heart disease or stroke, and having polycystic ovary syndrome are some of the contributing factors that put you at risk for type 2 diabetes. Meanwhile, India has over 100 million diabetics. This is what a study has shown, the ICMR India B study. As of 2023, India has over 100 million diabetics, out of which 136 million pre-diabetics are there, which is almost 15.3% of the entire cases. These cases are up by 44% in 4 years since 2019. So that's a huge jump as far as the number of pre-diabetics cases are concerned. 70 million diabetics, they were reported in 2019. That is 35.5% of them, they have hypertension or high blood pressure. Out of that, 39.5% have abdominal obesity, 28.6% they have overall obesity, and 24% they have high bad cholesterol level. Now, some of the top 3 diabetic states in the country. Surprisingly, Goa has 26.4% cases with type 1 as well as type 2 diabetes. Puducherry follows next, which has 26.3% diabetics, and then Kerala, which has 25.5% of the cases. Meanwhile, it is the World Diabetics Day today, and Some of the key issues that we need to address is diabetes management. This is also the mental health is also one of the reasons. How does diabetes affect mental health? That is also one of the questions. The well-being support system is something that also needs to be looked at. Prevention as well as early detection. These are the two key factors that can reduce the risk of developing type 2 diabetes. And the advancements in the treatment is something that we'll try and understand from our guest today. All right, Dr. S.V. Madhu, he joins us to have this conversation with us. Dr. Madhu, just first of all, just give us a sense of what are the most effective strategies for managing diabetes.
To all your viewers, good evening. Actually, the most important strategy for prevention as well as management of diabetes is a lifestyle change. And a healthy lifestyle is all that is important and is at the core of any diabetes management. No matter what drugs are there, no matter what drugs are invented, whether it's insulin or oral agents, I think lifestyle forms the core. And I would advise all your viewers to follow a healthy lifestyle if you're able to manage diabetes properly.
Right, absolutely. So it's also, diabetes and well-being is basically what the theme is this time around from 2024 and 2026. Mental health is also one of the key issues here. How does diabetes affect mental health, and what resources are currently available in order to support individuals who have diabetes, who are struggling with, anxiety, depression, or any other mental health conditions?
Yes, I think diabetes and mental health are very closely wedded. Both, it's a two-way relationship, as we call it. Diabetes can lead to absence or compromise of mental health, and a compromised mental health can also lead to diabetes. So it's a two-way relationship, particularly depression. Saying depression and anxiety are very common, and therefore it's always important. And we advise all our patients that if you want to maintain well-being, in fact, indirectly it affects the overall outcome in diabetic individuals as well. If somebody is depressed or anxious, then he will not be able to take care of himself, and that will lead to a worse outcome, increased mortality, and so on. And therefore, I think it's absolutely imperative that diabetic patients need to control, apart from controlling blood glucose, should also be bothered about and seek, whenever required, professional help or support from friends, family, or the healthcare professionals in order to improve their well-being. And I think recognizing this, the IDF is actually focused on the well-being as an important component of the person with diabetes, apart from just the medication and insulin and so on, and much beyond the blood sugar control.
Right. Dr. Madhu, prevention and early detection are also key, in fact, here. Just want to understand, how can individuals take steps to prevent or delay the onset of this particular disease?
Yeah, that's a very important question because the problem is huge, especially in our country. There are about 130 million pre-diabetic individuals who are ready to become diabetic. Therefore, all people who have pre-diabetes or at a higher risk for diabetes need to take a profound lifestyle measures. In fact, lifestyle is shown to be the best remedy in trying to delay or prevent diabetes, and therefore lifestyle is the most important thing. And recently, our group actually showed that yoga could be a very important additional thing along with lifestyle, which could help prevent the new onset diabetes. And the risk reduction was to the extent of 40% if followed on a daily basis for a package of, let's say, 40 minutes, which includes select yogasanas and pranayama. And besides lifestyle, if you add yoga, the two together, I think would be the best in staving off the risk of diabetes in the future.